James Donmoyer, drug and alcohol, mental health.
I'd like to introduce Jenna Coon. Jenna is an intern in my office this semester. Jenna is a psychology major at Lebanon Valley College.
Super. You want to proceed?
Hi. Again, thanks for inviting. We make this a team effort. Thanks for inviting us. It's been many years we've been doing this, and I think it's very informative for the county to know what's going on in the coroner's office. So we'll start. This is my report for 2016. Let me just say it was quite a year. Cremations, as you know, we have to approve every cremation in the county before they're cremated. And last year, we investigated 671. This year we had 750 cremations. We investigated 198 natural deaths. Last year we had 138. Accidental deaths have remained around the same. We had 16 drug-related cases, and I'm going to let Jim talk about that in a little bit. We had 14 motor vehicle accidents that we investigated. We had 2 cases of trees falling on individuals, and they happened within about 2 weeks of each other, and both were struck on the head. We had 1 anaphylactic reaction from a medication. We had 1 drowning, that was in Mount Gretna, and we had 1 tragic death recently of a elderly individual who was run over by her car. We had 2 homicides. We had 2 cases that were autopsied. They could not determine the cause of death, and those were both child deaths, but they could not determine what the case was. And we have 1 case still pending from last year. Suicides were markedly up this year. We had 20 suicides this year, which Kevin will talk about in a little bit. The ages there range from age 14 to age 82. They were predominantly gunshot wounds. 11 were gunshot wounds. 1 was a knife. 1 was a crossbow. We had 2 hangings, 2 gas-related cases, and 1 motor vehicle death that we determined it was a suicide. And we had 2 cases of asphyxiation. This year, before I turn it over, I just want to discuss, there seems to be some confusion in the community about how we investigate drug-related deaths. And I'm just going to go through so you know and the county knows. When we have a suspected drug overdose, we do our blood out, we do our toxicology. And if we determine that it's a drug-related death, it's automatically turned over to the investigating agencies, police agencies, and the DA's office. They try to determine whether we can determine where the drug came from. If we can determine, and we have a pretty good guess that we know the individual who delivered the substance that led to the person's death, we do an autopsy, and so we have our I's dotted, T's crossed, and we turn it over to the DA's office for prosecution. There seems to be a thought process out there that we don't do anything once a person dies from a heroin overdose. And I just want to make it known that we go above and beyond to try to find the person or persons who deliver the substance. We don't determine anything on cost. Whatever it costs, we're going to do to determine that. And I can tell you, and the DA can confirm this, that we have 100% success rate in prosecution so far when we've taken these cases to court.
How many of them went to court?
We've had 4 successful prosecutions, I think, probably in the last 2 years. So I just wanted to make that known. There seems to be a thought process out there that we really don't do anything to stem the tide of drugs in this county. And Jim can pretty well tell you my involvement in the drug world with the methadone center and the detox centers. We go above and beyond to try to successfully treat drug and alcohol addiction in Lebanon County.
I would like to speak of part of his report in reference to the drug overdoses for the year, the previous year. Just to give some historical background, in 2014, the county saw 18 overdose deaths. 2015, we saw 17, so it went down by 1, and this year we saw 16. 16, of note, I want to make at this point that out of the 16, 14 of them were heroin, opiate, fentanyl related, and what Dr. Yocum describes as mixed. A lot of different substances in people's body, but heroin, fentanyl, and opiate has been consistent with the mixed cases, 14 out of 16. The other two weren't involving any of those substances. I believe one had to do with alcohol and some medication. So this year again we've had 16. Well, this past year we had 16, so it's down 1 from the previous year. Out of the 16 deaths, 12 were male, 4 were female. The average age of the male was 34.7 years of age, youngest being 23, oldest being 49 years of age. The females, the 4 females, the average age was 39, the youngest being 26, and the oldest being 58. Again, as I already spoke about, we're seeing the main causes being mixed, where these individuals are using cocaine, alcohol, opiates, heroin, fentanyl, just a wide range of drug usage. The ethnic backgrounds, females there was 1 Hispanic, 2 Caucasian. Males there was 2 Hispanic, 9 Caucasian. What I want to make clear to everyone here is our office, we see over 700 people a year, and out of those 700 people we see a year, roughly 48% their main substance of use is heroin or opiates. So we're still seeing the numbers in our office. They remain the same, if not more. However, the deaths have been going down the past 3 years. Our hope is that that will continue to happen. This year, I can report that this year, since January 1, we already have 3 overdose deaths.
Wow.
So in 1 month, we've had 3. So that's not a good sign to start off. But we're hoping those numbers level off.
You see multiple substances in the system. A lot of times, it's heroin mixed with these substances. So when these people are out looking for their heroin, they have no idea what is in the heroin.
Yeah.
So a lot of times it's what we call laced with, cocaine or some of these other drugs, and they have no idea what they're buying. So it's not necessarily that they're using cocaine separately. It can be mixed in with the heroin. So when they buy it, they have no idea what's in it.
Kev, I got this line from Kevin, 1 is too many.
Yes.
Absolutely. 16, when you compare it to York, Dauphin, Lancaster, our numbers are way down. I mean, York County is, I should have brought those numbers with me, but
2016 was not a good year in terms of suicide numbers. We had a total of 20 suicides during 2016. And as we compare that with prior years, I always look at 2013 as being our milestone year, in that in 2013 we had 26 suicides, which was extraordinarily high based on the record keeping we've had for a number of years. So again, we started a number of efforts to try and reduce the number of suicides. So from 2013, when there were 26 suicides, for 2014 we had a reduction down to 20, and then in 2015 we had 13 suicides, which was much further reduction, and took us to 50% of what we had been 2 years before. So for 2016, as Dr. Yocum said, it did go back up to a total of 20 suicides for that year, which from a standpoint of a percentage, that is a 54% increase from 2015. We're disappointed to see that, and we continue our efforts. The Suicide Prevention Task Force is very well organized and very active. In fact, some people from other counties have come to ours and talked about how well organized the program is compared to other counties. So we're very pleased that we're doing that, and we will continue those efforts. And